Thursday, September 2nd, 2021, Canadian Autism Treatment for Medicare Coalition press conference in front of Queen's Park, Toronto.
Good morning, everyone, and thank you for coming to our press conference today. My name is Jamie Peddle, and these are my colleagues, Carla Pertwequin and Andrew Kabchak. I am from Brampton, and Carla is from Toronto, and Andrew is from Ottawa. We are all parents of children who have been diagnosed with autism and who are severely affected by the disorder. We are founding members of the Canadian Autism Treatment for Medicare Coalition, and you can find us on the coalition site on Facebook. We are here today to speak on behalf of all kids with autism and their families and caregivers who believe that the time is long overdue for autism treatment to be delivered through healthcare with Medicare coverage. Due to the COVID-19, we have kept this event small and limited the number of participants in order to comply with restrictions and to keep everyone safe. During this election campaign, we are once again calling on the Prime Minister and the leaders of the other parties to recognize the lack of access to autism treatment in Canada as a healthcare crisis and to pledge to put into motion the necessary mechanisms and undertake negotiations with the provincial governments to make ABA autism treatment universally accessible and covered under Medicare across Canada. I am a single father of 4 children. The youngest is a 9-year-old boy with severe autism who needs medically necessary autism treatment. The treatment is intensive behavior intervention therapy based on principles of applied behavior analysis, commonly known as ABA. The medical and scientific communities have long recognized that autism ABA is the only effective evidence-based treatment for autism. The studies and experience have demonstrated that ABA can have a huge impact on the development of children who are diagnosed with autism. Until the cause and cure of autism are discovered or a more effective treatment is found, ABA is the core healthcare need of children diagnosed with autism. It is long past time that both our federal and provincial governments recognize that autism is a neurological disorder that without treatment can be profound negative effects on the individual, their family, and their community. Many provinces over the years have launched ABA autism treatment programs. Ontario first launched the preschool autism program in 2000. Unfortunately, the program was not treated as a medically necessary health issue. It was not assigned to the Ministry of Health, and the program was not given OHIP coverage. Instead, as in so many other provinces, the ABA Autism Treatment Program in Ontario was assigned to the Ministry of Social Services. This is a fundamental error in public administration and programming infrastructure. The department that administers welfare does not have the same culture as the department that administers healthcare. Healthcare is based on the needs of the patient, and appropriate autism treatment is more likely to be effective delivered by the Ministry of Health than Social Services. The Ministry of Social Services simply does not have the healthcare expertise or the resources to adequately do the job. Since inception, the Ontario program has been plagued with unconscionable waiting lists and discriminatory age cutoffs. Because ABA is not covered by Medicare, the cost of providing medically necessary treatment has often fallen to the parents who are forced to resort to the private sector. The consequences are that many of our children are not receiving treatment because of their families' inability to pay. This is not only un-Canadian, it is immoral. Over the past 2 decades, the Ontario program has been routinely subjected to tinkering by the government, and today the program is in shambles. The government of Ontario announced changes to the Ontario Autism Program in early 2019, which proposed to give every child a check for approximately 1 month's worth of treatment, which effectively gutted the program and resulted in widespread opposition from the autism community. Since then, the waiting list for access to treatment has grown over to 40,000 kids. The solution is to have ABA universally accessible and covered under Medicare. This means that our federal government must get involved. This is no longer just a provincial issue. The federal government issued a report indicating that the incident rate is 1 in 66 children. Many of these children need treatment, and the lack of access is a national autism crisis. The federal government owns the Canada Health Act and provides healthcare funding to the provinces through the Canada Health Transfer. The federal and provincial governments have routinely negotiated health accords with the federal funding specifically tagged for certain healthcare services. Federal leaders have indicated their plans for increasing the Canada Health Transfer and introducing pharmacare, dental care, vision care, and doubling direct investments into palliative care. We need commitments for autism care. What about autism care? The time is long overdue for autism treatment to benefit from the system that has so far ignored the autism community. Over 2,000 Liberal delegates at the party national convention in Winnipeg in 2016 overwhelmingly voted to pass this resolution, calling for Medicare coverage of autism treatment. This resolution clearly lays out the roadmap of how to solve this issue. So what has the federal government done since 2016? Nothing. And that's why we're speaking out. Even Justin Trudeau has even said, and I quote him, "How we care for the most vulnerable people in our society is very important." He even said that a couple months just before this resolution was passed. In December 2019, the Prime Minister gave the Health Minister a mandate letter calling on to work towards the creation of a national autism strategy. Here we are, 2 years later, and there's no national autism strategy to speak of. In 2007, the Senate of Canada issued a report called Pay Now or Pay Later: Autism Families in Crisis. Among other recommendations, this report calls for the federal government to provide treatment funding. It is 2021, and the crisis has only deepened. The federal government must work together with the provinces to move autism treatment to where it properly belongs under the provincial ministries of health. Include ABA in each province list of publicly insured health services, and provide adequate funding to the provinces to cover the cost of treatment. It is in our collective economic interest to provide early intervention treatment, because untreated children will become untreated adults who will require a lifetime of supervision and long-term care at tremendous expense. The more children with autism are able to develop their full potential, the less will be the cost of their long-term care as adults. As Canadian citizens, we have all been conditioned to pay our taxes on the understanding that Medicare will cover our core healthcare needs. ABA autism treatment is my son's core healthcare need. Where is Medicare when he needs it? In closing, I am calling on our Prime Minister and the leaders of the other parties to recognize the lack of access to autism treatment is a healthcare crisis. We need whoever wins this election to act immediately by doing what this resolution instructs. He must put into the motion the necessary mechanisms within the federal and provincial governments to make ABA autism treatment universally accessible and covered under Medicare. This health care discrimination against Canadians with autism must end now. Thank you. And I now invite Carla Patriquin to speak.
Good morning, and thank you all for attending our press conference. Having a severely disabled, nonverbal autistic son has opened my eyes to Canada's discrimination in healthcare. When my son was just over 2 years of age, his autism became abundantly apparent. Behavioral challenges escalated into full-out self-injurious meltdowns. His sleep came in 2-hour intervals with intermittent screaming for hours. He had no ability to engage, communicate, or self-regulate. With great concern, his pediatrician evaluated no underlying health conditions, informed me my son is autistic and will be put on the list for official evaluation from our children's hospital. He advised me my child required intense behavioral intervention IBI treatment based on the principles of applied behavioral analysis ABA to progress and develop to his full potential. However, the pediatrician had no ability to refer my son or prescribe the treatment for him. An official diagnosis would be required from a specialist in order to access any treatment and services. When a child is diagnosed with autism, there is an urgent need for treatment. Early intervention generates best results for a child's development. My assumption was the Children's Hospital would provide an official diagnosis and access to therapy would follow. That did not turn out to be the case at all. As a parent in distress about my son's condition, I was shocked when his diagnosis led to being put on a regional wait list of the Ministry of Social Service for access to therapy. There are simply no words to describe the blatant lack of autism treatment in the healthcare system. We were informed we could resort to the private sector and pay for treatment. I never thought in Canada a disabled child in urgent need of treatment would be told to consider the private sector. Who in Canada buys health insurance when we have Medicare? Unfortunately, for the many families like mine, the cost of medically necessary therapy in the private sector is simply unaffordable and out of reach. Many children are in full-out crisis. They have 24/7 care needs, serious language disability, and are being denied evidence-based therapy to progress. Those who believe that IBI, ABA, autism treatment is too expensive for the healthcare system need to consider the fact that autism treatment changes the lives and trajectories of the children. Many adults with autism who were never able to access treatment are on unconscionably long wait lists for placement in group homes. In the meantime, media reports regularly highlight the plight of those housed in psychiatric wards of hospitals as their elderly parents can no longer handle extreme behavioral challenges. It most certainly did not have to be this way. Evidence-based treatment can improve quality of life. Canada must implement a national autism strategy of which a core pillar must be enabling diagnosed children with autism to access intervention treatment through healthcare pursuant to national standards and with Medicare coverage. I thank Andrew Kavchuk for his years of advocating for the many children like mine. All politicians and interested persons should read the book, The Fight for Autism Treatment in Canada, and realize this merry-go-round of social services files and discrimination in healthcare must end. A true national autism strategy must include Medicare for autism treatment. We need Medicare for autism now. Thank you.
Thank you, Jamie, and thank you, Carla. My name is Andrew Kovchuk, and I am the parent of a 20-year-old young man who is severely affected by autism. We are here to ask federal politicians to put an end to the discrimination in Medicare against Canadian children with autism and take the steps necessary to ensure that treatment for autism is delivered through Canada's healthcare system and covered by Medicare from coast to coast with federal funding through the Canada Health Transfer. The provinces are responsible for the delivery of healthcare, but when it comes to autism treatment, they have dropped the ball. Many provinces like Ontario offer autism treatment programs through the Ministries of Social Services, which don't have the expertise or the resources. During the last federal election in 2019, the Liberal Party did not make any promises relating to autism. However, in the December 2019 mandate letter, the Prime Minister asked the Health Minister to work towards the creation of a national autism strategy. He did not request the development and implementation of a strategy, but just to work on it. So it should come as no surprise that here we are, 2 years later, and there is still no national autism strategy, no indication of when we will see one and what may potentially be in it. The government instead has launched another consultations festival. The autism community has already been through this consultation process several times, and we're not impressed. In 2007, we were consulted by the Senate Social Affairs Committee that conducted an inquiry into funding for autism treatment. That committee recommended that the federal government negotiate a funding formula with the provinces. The government ignored it completely. In 2015, the previous government budgeted $2 million for the consultations to develop a Canadian Autism Partnership Project. Almost 5,000 people were surveyed and participated in round-table events, which led the report authors to conclude that, quote, the people have spoken. And what did the government do? They completely ignored it, just as they did in 2007. The autism community has also experienced this kind of consultation dead end at the provincial level many times over the years. In 2019, when the Ontario government here at Queen's Park began consultations about the autism program reform fiasco that they started that year, many parents, including the three of us here today, made submissions to the working group calling on Medicare coverage for autism treatment. Yet, when the consultative report came out later in the spring or the fall of 2019, it didn't say a single word on the issue. In other words, our voices didn't matter. In 2020, the federal government announced it would spend $1.4 million on consultations to be carried out by the Canadian Academy of Health Sciences for purposes of developing a report with recommendations for a national autism strategy. And what will the government do once it receives that report with those recommendations? The federal health minister has already stated that they will be subject to further consultations. The autism community has had enough and is fed up with this consultation merry-go-round to nowhere. We want action, and we want it now. Parents like us who lobby our politicians always encounter resistance and excuses. Yet, during this pandemic, the federal government has taken swift action when it perceives there to be a crisis. We would like to see the same kind of decisive decision-making and corresponding action with regard to autism treatment. We are asking for the leaders of the parties to commit to implementing a national autism strategy that will have as a core pillar the provision of Medicare coverage for autism treatment. We are calling on the federal government to convene a meeting with the provinces, put some money on the table along with other incentives from their toolkit, and negotiate with the provinces a health accord that will ensure autism treatment provided through healthcare pursuant to national service standards and with federal health transfer contributions. To those who say that it can't be done, we point to the current existing healthcare system of rehabilitation services delivery, which can be used as a model for the delivery of autism treatment through healthcare with Medicare coverage. In Ontario, the Ontario Health Insurance Plan, OHIP, covers the cost of inpatient rehabilitation care. Rehabilitation services often are needed to recover from illness, surgery, and accidents. Rehabilitation can also take place in an outpatient clinic, the home, or community, and that may also be covered by OHIP. Such rehabilitation healthcare services typically involve one or more members of a rehabilitation team, consisting of a psychologist, physiotherapists, occupational therapists, speech therapists, social workers, and nutritionists. Why can't board-certified behavior analysts who are specialists in autism treatment be added to the mix? In every election, the autism community hopes and prays for political leaders to confirm that our children with autism matter and that they will do something to help improve access to treatment. Regrettably, previous elections have been disappointments, and so far, this one is no different. The Liberals have pledged $4.5 billion over 5 years for mental health. The money is to be transferred to the provinces through a new and permanent mental health transfer. That's something that we are happy to support and would be glad if they would increase it even. But what about similar federal funding arrangement for autism treatment? Why is autism treatment always excluded? The Conservative election platform says nothing about autism. However, it proposes to spend an additional $60 billion over 10 years on healthcare, which is supposed to provide enough funding for an additional 1 million Canadians to receive mental health treatment every year. Why are kids with autism excluded from this healthcare windfall? O'Toole, the Conservative leader, has stated that autism treatment is strictly a provincial responsibility and has nothing to do with the federal government. Yet, the Conservative election platform proposes to double the amount of direct investing in palliative care. That's wonderful. And again, we support that and think it should be increased. But if Canadians on their deathbeds warrant an election promise of doubling direct investments, what's it going to take for disabled children with autism to get a commitment from the Conservatives? Similarly, consecutive federal budgets now seem to have a mandatory provision for huge sums to be spent to tackle the opioid addiction crisis in this country. In their election platform, the Conservatives described the opioid epidemic as a healthcare issue, but they don't say it's strictly a provincial problem. Instead, they're pledging to spend hundreds of millions of dollars to create 1,000 residential drug treatment beds and build 50 recovery community centers across this country. That's great. Once again, we support that and think they should even increase it further. But if adults with addiction problems are worthy of federal direct investment, what will it take for the Conservatives to spend a dime on autism treatment for kids? With regard to the NDP, they've made it very clear that they believe the Canadian healthcare system is based on a 1950s model of healthcare delivery. And we agree. They propose to open up the Canada Health Act to modernize it by introducing pharmacare, dental care, eye care, but they don't say a single word about autism care. Why? We are only asking to be treated as all other Canadians under Medicare. What all the promises during this election from the federal parties demonstrate is that where there is the political will, there is a way. Where is the political will to help kids with autism get access to treatment? We need Medicare for autism now. Thank you.